You have the power to stop this virus.
By being fully vaccinated, you are not only protecting yourself, but also those who are unable to get the vaccine,
such as children under the age of 12.
Our greatest tool to beat COVID-19 and its variants is in your hands, Philadelphia.
And we're counting on you to use it.
Juntos hay que proteger nuestra comunidad y vacunarnos hoy.
Together we will beat COVID-19.
2021 has been the worst year for homicides in Philadelphia history, with more than 500 people killed so far, most by gun violence. And for every death, there are many more people who survive gun wounds, only to suffer life-changing physical and emotional injuries. Plus, there's the trauma borne by families and entire communities. The causes are complex and historic, among them racism, poverty, and underemployment, all made worse now by the pandemic. It's a crisis that touches all aspects of society, as communities, politicians, law enforcement, the criminal justice system, and the healthcare system scramble to respond. Today, on Inquirer Live's Health Report, we talk to Philadelphians who see gun violence victims on city streets and in emergency departments every day. They're using public health tools to heal physical and emotional trauma and to discover more effective ways to prevent violence in the first place.
Hello, everyone. I'm Charlotte Sutton, health editor of the Philadelphia Inquirer. Though we plan our Inquirer Live health reports months in advance, today is a case where we are right on top of the news. Today's headlines bring us fresh reminders not only that gun violence is at peak levels in Philadelphia, but also that this is a very hard topic to talk about. District Attorney Larry Krasner's remarks this week, I think the exact quote was, "We don't have a crisis of violence," have outraged many in our community, with former Mayor Michael Nutter even demanding that he apologize. That's the news of the day. But for the next hour, we are going to focus on one very major piece of this complicated, long-standing issue, and that is the healthcare and public health aspects of the gun violence crisis. Our expert panelists deal every day both with the physical and emotional healthcare needs of gun victims and their families, while also using the tools of public health to address the root causes of violence in order to save more people from this trauma. We welcome your questions on public health approaches to the gun violence crisis. Please submit them to inquirer.com/healthreportlive. We have a lot to talk about, so let's get to it with our panelists. I'll introduce each of them quickly and then pass the microphone to each of them to tell us what they're doing now and why they're devoting themselves to this critical issue. Rodney Babb is Penn Presbyterian Medical Center's first violence intervention specialist. Dr. Jessica Beard is a Temple University Hospital trauma surgeon and a Stoneleigh Fellow, who is the research director for the Philadelphia Center for Gun Violence Reporting. Scott Charles is Trauma Outreach Manager at Temple University Hospital and co-creator of the very successful Cradle to Grave Violence Prevention Initiative. And finally, Arturo Zinni is Program Director of Healing Hurt People at the Center for Nonviolence and Social Justice at Drexel University's Dornsife School of Public Health. So with that, let's turn to you, Rodney. Can you tell us a little bit about yourself and what you do every day at Penn Presbyterian?
Hi. So just about myself, I'm from Philadelphia, born and raised, went to the public school system, eventually went on to college and currently get my MSW from Westchester University. Here at Penn Presbyterian, we started our first violence intervention program, and my role here is to support our survivors of violent injuries, whether it's gunshot wounds, stab wounds, whatever violent injury that is. That's my role to support some outpatient. And how that looks is usually when someone comes into the hospital with a gunshot wound, they don't usually receive support for outpatient. So that would be my role to come in and intervene and support them with whatever they may need when it comes to PTSD, any type of disparities they're facing outside or anywhere in life. My goal is to support them and to provide them with the adequate services from the community, but also through Penn to ensure that they can recover physically, but also mentally.
Wonderful. Thank you, Rodney. Jessica Beard, you're next.
Thanks so much for having me here, Charlotte. And I'm really grateful for the opportunity to participate in this panel with these great colleagues here. I'm also really thrilled that the Philadelphia Inquirer is centering gun violence as a health issue with this discussion. So as you heard, I'm a trauma surgeon at Temple. Temple's the busiest hospital for gunshot injuries in the city. Just last night, within a span of about an hour, we had 6 patients present to our ER after being shot. And I wasn't on call, but I stayed late to help my colleague who was on call respond to these gunshot wounds with both medical and surgical care. And for us, that's a mass casualty event. But I wonder, did you hear about that event as a mass casualty? Did you hear anyone in media calling it a mass shooting? Every month or so, we respond to an event like this, what we call really like an everyday mass shooting. And these events have the potential really to overwhelm us and our system, which is already quite stressed by COVID. And as you mentioned, we've had a concomitant massive uptick in the rate of gun violence since March of 2020. And really, this is our daily reality. Telling a patient's mother that he's died, dealing with these mass shootings, cleaning up the blood off the floor of our hospitals. And as a trauma surgeon who's trained in public health, it's really a no-brainer that this is a health issue and this is a public health issue. We're always on a state of high alert at Temple, but the volume of injuries that we're seeing now and the community trauma is really unprecedented. So my work with the Philadelphia Center for Gun Violence Reporting has been trying to investigate how we can use media as a public health tool to prevent gun violence, essentially to educate the public on root causes and solutions for gun violence. So I'm really thrilled to talk about that more and thankful for this opportunity.
Absolutely. I can't wait to hear more about that. Scott, Charles.
Hi, again, Charlotte, I echo what Jessica said about, having us involved, but also really centering the issue of gun violence, especially in a public health context. I'm from California. I've been in Philadelphia. I spent the majority of my adult life in Philadelphia, but was born and raised in California. I am a sibling to 3 siblings who were victims of gun injury. This is something that is very personal to me. And how I came to be at Temple is I happened to encounter a pretty dynamic surgeon at the time who was the chief trauma surgeon at Temple Hospital. And I was working with a group of young people, and we got to talk to them about the medical realities of gun violence. And I think she and I both recognized almost immediately, though I wasn't at the hospital, that there was an opportunity here to discuss this aspect of gun violence that it was a departure from what kids usually see and how it's represented in media, and to talk about the impact that it has from in medical terms, but in terms of society and families. And so we joined forces in 2005, and in 2006, we launched the Cradle to Grave program, which had that as its goal. And, to hear, and I appreciate the compliment that it's a successful program, but I think as we were here in 2021, 15 years after launching the program, we can't help but question the value of this program or all our efforts. And, asking ourselves the tough questions of, what could we be doing better? And so, our work has evolved over the years. Today, we are looking at unintentional gun injury and giving out gun locks at the hospital in the context of my role as the outreach coordinator, outreach manager. We're doing things like teaching, sadly, gun violence first aid in communities that are most impacted by gun violence. But importantly, as Jessica mentioned, last night when you have 6 shooting victims that are coming in back to back to back, historically, we've not really had support inside the hospital that could could, support the families and support the victims on their medical needs. And so we now have a team of crisis responders who are embedded in the hospital, whose sole roles really revolve around providing emotional support to those families and those victims in real time. And we're thrilled that the hospital has made that kind of commitment and recognizes the need for this kind of work. So I'm thrilled to be part of this discussion and look forward to sharing with my colleagues here.
Okay, great. And Arturo Zindi, tell us about your work at Drexel.
Hello again, Charlotte and everybody. Thank you for having me. And as everyone else said, I'm thrilled to be here on this panel. So I'm originally from Argentina, born and raised, and almost 16 years ago, I moved to Philadelphia, and I've been working with communities, underserved communities impacted by trauma and violence and racism and poverty through the past decade and a half. And I joined Healing Hurt People 3 years ago. We are a hospital and community-based violence intervention program serving people children ages 8 to 18 and young adults up to 35 who are victims of intentional injury, violent injury, which we define as caused by gunshots, stabbings, and physical assault. So the program has been in existence since 2007, co-founded by Dr. John Rich and Dr. Ted Corbin, who are both physicians and public health experts who really, more than 15 years ago, saw the need to create a hospital-based violence intervention program to serve mostly African-American men who were victimized at alarming rates. The program started with Hahnemann Hospital. We all know that sadly it was shut down 2 years ago. But since 2010, we have been operating at St. Christopher's Hospital, which has an amazing team of clinicians, doctors, nurses, social workers. So a lot of our referrals come from St. Chris. We also have partnered with local schools, social services and health services programs that refer people after being violently injured to us. And there's 3 pillars to our services, which are trauma-specific mental health therapy, peer support, and case management around unmet basic needs. And one of the things that I think have made us successful or effective as a program is that we are able to provide services wherever the child, the adult, or the family prefers, whether it be at their homes, so in the community, schools, at the hospital, in our office. So we have that flexibility when it comes to the setting of the services we provide. And we usually serve people for up to 12 months.
Terrific, thank you. Let's start with a little public health 101, because I think that most people can understand if you look at something like COVID, the prevention issues are pretty clear. You get vaccinated, you wear your mask, you keep your social distance. But with gun violence, it's not exactly clear how classic public health measures can function as a preventive. Could one of you jump in and just explain how gun violence prevention fits in that model of preventing communicable diseases, if you will, through public health tools?
Do you want me to go?
Sure.
Okay, so first of all, I think a lot of people have been saying that gun violence is a public health problem and not really knowing what that means exactly. So I really appreciate that question. I think central to the idea of public health and a public health problem is that it's preventable, right? Public health, one of the main tenets of public health is that the best place to intervene is before a health problem happens, right? It's not me in the hospital doing surgery on somebody who's been shot. It's actually preventing that person from getting shot and going as proximal as possible to the root causes of the problem. So that's kind of pillar number one, is it's preventable. Now, violence is not as simple as an infectious disease. There's no vaccination to prevent violence, but there is a public health approach to violence. And I didn't make this up. The CDC basically kind of says that this is the public health approach to violence. So the first thing is to define the problem, right? So one of the big challenges that we have in approaching gun violence is that we don't have great informational sources. We don't have great data sources because for a long time, our national bodies, the CDC specifically, have been prevented from collecting data on gun violence. So we've kind of patching that information together. And that's really important because as you test interventions, you need to have reliable data that says, well, at this point when we did this intervention, gun violence went down or it went up. In the city of Philadelphia, we've been using the police data for shootings, but it would be great to have an epidemiologic data source. So that's step one. Step two is you look at what are the risk factors and what are factors that protect you against gun violence or violence in general or any public health problem. Then you develop and test prevention strategies. One of the main other kind of pillars of public health is that you, when possible, want to have evidence for what you're doing, right? So any program that you design should also have an evaluation component, and you should be looking at, outcomes that are valuable and defined for that program. And then you want to assure widespread adoption. So you want to, take a program that might work in another city and implement it systematically in your city or in multiple different places, right? So if we're talking about the hospital-based violence intervention program that folks here are involved in, you want to see what it works, what are those outcomes that we're looking at, and then kind of have it citywide so that every patient, every victim of gun violence has access to those things. So that's kind of that in a nutshell, the public health approach.
Okay, great. One of the things I found very interesting when I was doing a little research on this is that the American Public Health Association is very firm, saying that prevention does not require predicting who will be violent. That it's totally unlike the criminal justice system where we're always trying to figure out, okay, you're going to be violent, so we're just going to put you in jail forever. This is completely different. I don't know, Scott or Arturo, is there something that you can look at in your experience to try to explain to people why it's not so important in the public health approach to be able to predict who's going to be violent, as if such a thing were possible?
I was going to defer to Arturo so that it wasn't so temple laden.
That's okay.
And I was going to defer to you, Scott, but we can do it together. I will. I think that's a very important point, Charlotte, you're bringing up. And to go back to what you mentioned earlier, I think when you frame gun violence as a complicated public health issue, which I think that's exactly what it is. And as Jessica was saying, all the different levels of public health that we have to consider when intervening and trying to prevent gun violence. When it comes to the work that we do at Healing Her People, and you're totally right, a lot of times, or when the program was originally created, there was this really big expectation on, preventing retaliation. What is your program doing to show that you're decreasing, subsequent crime or subsequent gun violence or retaliation? And really, the shift that we have made and who we are as a program is we provide services that are healing to those impacted by violence. Mental health, trauma therapy, case management, peer support, as I mentioned. So our goal is to help people heal from trauma, while being very strong advocates about conditions that clearly perpetuate gun violence, such as ongoing poverty, lack of employment, unsafe neighborhoods, etc. But I think it's our own shift that we are not part of the judicial, law systems, which are very important, right? We're here to help people heal.
And having said that, and I agree with everything that both of my colleagues have said, I think we can also, though, recognize that the people that are exposed to violence are more likely to be either victimized or to perpetrate violence. We know that there's a contagion effect when it comes to violence. I think the thing that is consistent with what you quoted is the fact that, as was evidenced recently, that violence in America touches just about everybody from all walks of life in almost every corner of America. We saw it with a student who was doing absolutely what you'd expect a student to be doing recently who lost his life. The fact of the matter is that when we look at the circumstances that Arturo mentioned that tend to contribute to communities that are impacted by violence, until we address those underlying issues, those root causes, the fact is that nobody is going to be safe, perfectly safe, until we're all safe. And I think that it behooves us to try to address those underlying issues, because eventually it's inevitable that somebody that is within your circle will be impacted by this issue.
Yeah. And speaking of these factors, Rodney, when you and I were talking on Zoom the other day, you told me the story of a young man that you met at Penn Presbyterian, and you talked about the environment that he was going back to. I wonder if you could share with us the, maybe some stories of the folks that you're working with, and what they want to do with their lives versus what the reality of their lives is forcing them back to. I think you're on mute right now. If you could unmute, there you go.
So for a lot of the young men that I work with, their goal is to go to college or get a trade or to better their life. And I think that for me, I do that by bringing them to the campus at University of Pennsylvania. So exposing them to different atmospheres that they're not used to, as far as just their normal neighborhood where a lot of violence takes place. I show them around campus. I sometimes go into the library and we do job applications or whatever it is that they need to get done. But primarily for this particular young man, not even just this one, but a lot of them, they go back to violence. So they come in the hospital, they're here bedside, I meet with them. And then when they are released, they go back to violent neighborhoods, violent homes. They're surrounded by people, or their community is, not adequate enough to help them heal. In order for someone to heal, I think that it's not just a mental thing, a physical thing, but it's also your environment that needs to support you as well. So by saying that, the young man, he was going back to the environment that got him into the hospital in the first place. So the goal is, for me, is to support people with relocation. So relocation looks like getting that person and that family out that specific neighborhood where that violent interaction occurred, but putting them into another area of the city, or just another area where they can feel safe, where they don't have to look over their shoulders, where they don't, where they can actually get some rest and sleep. A lot of the guys who I work with has PTSD. They aren't able to sleep. They are up all night, and they're only able to sleep in the morning time because at night they feel like someone is out to get them, or they just want to watch their back. So, I think that for that specific group of population that I'm working with, those who are suffering from PTSD and those who are going back to that same environment, the goal is to provide them with a new environment, to introduce them to different environments that they're not used to. And I think that's something important that a lot of people don't see, is that the environment is also detrimental to someone's healing process.
And how, for any of you, how often is that possible to do? Because it really sounds like a lot of Philadelphians are really stuck in a cycle that is very difficult to get out of.
For me, I would say it's really hard to do, because a lot of people are like, I don't want to move in that area. They were just shooting there, or I don't want to move in that area. So there's not a lot of areas where people feel comfortable with moving to. I would say a lot of people that I've worked with, they're used to one section of the city, so they're not comfortable going to other sections of the city, and that may be more harmful than where they currently live now. So it's all about, I think, just finding the right resource or environment for that person. I believe that you can live in wherever part of the city you want to live in, but I think that it's just the environment in the area, that whatever they feel comfortable with.
Yeah.
And I would, Charlotte, and I totally agree with Rodney, and to piggyback on him, what he said, it's pretty challenging to be able to relocate people. We have a lot of requests, and they have increased for people who want to support around relocation and victims' compensations assistance, which is funded by the state of Pennsylvania. It's a great resource. A lot of times provide temporary emergency relocation, but to be able to move to a different neighborhood, as Rodney said, like there's the need exceeds I guess what the city can do in a big way. So
yeah. Now, another thing that Rodney mentioned, Arturo, that I think you can speak to, the issue of PTSD. You mentioned earlier today when we were messaging about the importance of evidence-based therapy. Can you talk a bit about what that is and what that looks like for victims of gun violence?
Sure, yes. So there's been different studies authored by programs, including ours, but programs all across Philadelphia and the United States, showing the high prevalence of PTSD and traumatic stress reactions among survivors of gun violence, right? There was a study like something like 75% of people who had been shot showed clinically significant PTSD, which, as Rodney said earlier, means that they're not able to sleep, they're having nightmares, they're having what we call brain-body reaction, feeling reactions related to either being shot themselves or witnessing the shooting of a loved one, which sadly is very common in Philadelphia. So at Healing Her People, we implement evidence-based practices, which basically means that they have the strongest evidence for being effective when implemented with, in this case, survivors of gun violence. So for children and adolescents, trauma-focused CBT has the highest level of evidence. And the way it works, like you meet for about 20 sessions with the child or adolescent and the parent, and you help them with, first we always tell kids and teens, right, like building your toolbox, right, of tools that you can use when you are reminded of the trauma, right? So let's say a kid who was shot on their way to school, and now because of a PTSD overgeneralized response, they're not able to walk to school at all, even if, let's say, it's safe, right, to go to school. So the kid now is truant because of a PTSD reaction. So that's how you work to help them, of course, always assessing safety and coming up with safety plans as needed. But and you work with the caregiver, who's the most important person in the child's life, to make sure that what you're teaching or working with in the therapy session or with a peer specialist gets generalized to other settings, right? And for adults, we used cognitive processing therapy also with a very, very strong evidence for being effective. And, we're very proud of, increasing access through public health lenses, right? Increasing access to evidence-based practices for underserved communities who usually do not have access to such services.
Yeah. And we've certainly seen that through COVID. The same communities that are suffering most from gun violence have been suffering most from COVID. And so the trauma is compounded. Scott, in your work with Cradle to Grave and with the other programs that you're involved with, what are you seeing as being the most effective interventions for people who are going through this trauma?
I mean, I think all of the things that both Arturo and Rodney had talked about, particularly when it comes to therapy and support, are critical. One of the ways that we're trying to expand on the work that we're doing at Temple is by incorporating mental health support directly at point of contact. Until recently, most of the work that we've done has involved referring patients out to mental health support, and we're now getting the kind of grant assistance to allow us to do this work in-house. But I think it's critical because it speaks to something that both Arturo and Rodney talked about, and it is, what happens in the wake of this violence and how does it impact individuals, particularly when we're talking about PTSD. This idea of avoiding the places that you associate with violence. It's in the neighborhood where you live. The reason that they tend to stay in the neighborhood is, think about what it would mean for any of us to pick up everything that we know and just to relocate to somewhere we don't know that may in many instances be just as unsafe as a neighborhood from which we come. The neighborhood in which we live at least we have it may be imperfect, but it is at least a social network of support that we know and we understand. And so a lot of times individuals will stay in those neighborhoods. When they do that, and when they opt not to avoid, and they engage with that community, as we would all want to do, there is a heightened sense of being alert or being on point or being afraid. And sadly, a lot of times that results in additional violence. The fact that you want to be protective. One of the things I hear from survivors all the time is that, I've got one responsibility, and that is to myself or to my children. And so, especially after they've been wounded, they become much more concerned about their safety. And without providing them the type of mental health support, what we have to worry about is that, today's victims will become tomorrow's perpetrators. And so I think, mental health support is so critical to interrupting these cycles of violence.
Is there evidence? I mean, I know it's very, very difficult to gather data, as Jessica referred. The U.S. Congress, in its infinite wisdom, decided some time ago that any kind of public health research that might result in a recommendation to limit guns would be a very bad thing, and therefore must be banned. And that has made research very difficult. But even with that in mind, is there evidence that helping people through mental health counseling and other supports is connected with less gun violence, or do we just not know that yet?
What I could say, at least based on, at the Center for Nonviolence and Social Justice, we do have a research arm it's evaluating our program and showing promising results. From like a clinical standpoint, all of our clients, of the people who we work with, we do what we call a pre and post PTSD assessment and a depression assessment. Mm-hmm. So we're seeing a very promising improvement of both PTSD and depression symptoms, which, as was mentioned earlier, could mean the difference between somebody being able to function on a daily basis or not, and being able to go to work or go to school, be there for your kids, care for your kids, etc. When it comes, I couldn't say when it comes to how, is it decreasing gun violence? We definitely talk about healthy conflict resolution with kids and adults. We have, like, as all the programs here today, a very strong peer support component, young men and women with similar experiences of violence as those who we serve, who are credible messengers when talking about why do we have to really focus on non-violent conflict resolution strategies. So I think we're definitely adding, all of us, all these programs here, we're doing what we can to decrease it.
Yeah.
Charlotte, I'd like to just say something, if that's okay.
Of course.
I just wanted to add a bit of a different lens to the conversation around this kind of public health approach to gun violence. So, while it's very important to intervene from a public health perspective and from sort of a kind of psychological perspective on the level of the individual, which is kind of what we're talking about here, with the idea that, hurt people may go on to hurt other people. One other very important aspect of what, at least to me, it means to take a public health approach to gun violence is to really focus on the root causes of gun violence, kind of at a societal level. Mm-hmm. So just as you might think about not sending an individual back into the kind of environment where they were injured, you also have to think about, well, what can we do to make the places where people are better, right? In Philadelphia, gun violence risk is place-based. We know from our work that goes all the way back many, many decades to the racist practice of redlining. Those are still the places in the city where people get shot today. So really thinking about how we invest in places, whether it be, the built environment, right? That's just one piece of the puzzle that has some promise in terms of kind of improving, buildings and access to green spaces and those kind of things, right? That's just one piece of the puzzle. That's what public health is about, is, filling in those pieces, but also it's about people getting opportunities and employment and true, dismantling of the structural risks that are associated with gun violence. So I just wanted to kind of put a plug in for that. And I think, that's where this is very different than law enforcement, which is focused on, holding someone accountable for committing a crime. It's very different from what I do, which is about, helping an individual survive their physical wounds. And it's where I think the media has a big role to play too, in helping the public understand, not that it's this young man who was shot on Broad and Tioga, the police have no motives, right? Which is our kind of usual episodic report that might result in victim blaming, but actually really talking about what solutions work and making people feel like a little less helpless, right? We have solutions, right? Scott, I know the work that Scott does very intimately, and there's a lot more that we can do. We can get a psychologist directly to our patients, in our hospital, right? We don't have that. We're looking for support for that. We can, improve, help people get jobs, after they've been injured. We can, deal with policies that cause people to get shot, right? Like around legal gun ownership. I mean, there's just so many levels at which we can intervene. And that's really what kind of the public health approach means.
Right. And also education is a huge piece of it as well. The school system and helping kids to see that there are opportunities in the world that they can look forward to. It's just in the past week in the Inquirer, my colleagues have written a couple of really in-depth and stories that I think go to the issue as well of how do we tell stories about gun violence as a public health issue. In one case, it was a story of a young man who survived gun violence and described his way back. He's been, in rehab for over a year. He started out paralyzed. He's now learning how to walk up the steps again. Another story was about a group of women who are taking children who have been orphaned or lost family members and taking them for, retreats to the Poconos, where it's safe for them to talk about their experiences. So I think those kinds of efforts maybe provide a richer picture of what people are going through and perhaps expand understanding. But Jessica, your work, you are taking a much more systematic view of how the media reports on gun violence. Can you talk some about that?
Yes, thank you. And I don't by any means mean to say that there aren't great narratives and storytelling around gun violence in our local media. So I wouldn't want to discount that at all. But I do think that, number one, the narrator is really important, right? So a lot of times the kind of information sources that we see in media reports are law enforcement. So I think centering the victim, their family, healthcare workers, just hearing different perspectives on the problem is really important. There's a whole kind of area of journalism called solutions journalism, which is focused on not necessarily like a puff piece, not just saying, oh, this is, something great that's happening, but actually dissecting, is this a solution? Does it work? So like looking into these hospital-based violence intervention programs and figuring out what should the outcomes be? What is the evidence for those? Would be a great example of reporting. And what we're trying to do is actually, kind of do some research on this. So we've interviewed 26 of our patients who've been shot, and we're doing what's called a qualitative study. So asking these questions and looking at what they have to say about the media's reporting on their own injuries. We're looking at how the TV talks about gun violence. And then we're also going to be interviewing journalists as well, with the goal to get to what does the most ethical, the most impactful reporting on gun violence look like, informed by what people who are actually injured by gun violence feel. So.
And if I could just say, Charlotte, I think, to kind of link this to public health, I think the role that media plays in terms of humanizing this issue is so critical. You have great columnists there, great writers there, As Jessica said, I don't think this is to in any way demean the work that they're doing. One person that comes to mind is Helen Ubenius's work, talking with victims and their families. There are plenty of others. But when I think about the way that we think about the victims of gun violence and the way that we tend to moralize this issue and to blame the victims, it really harkens back to the AIDS epidemic and the fact that when we look back in retrospect at the way that disease and that issue was reported on, the way it was reported in mainstream media and by just about anybody, we're horrified when we look back at the way that issue was addressed and the way that it stigmatized this issue. We've not quite gotten there when it comes to gun violence because we tend to continue to feel very comfortable with moralizing and demonizing those who are the victims of this disease.
Yeah. No, it's interesting. We, at the Inquirer in the last year, we have done a lot of self-examination of how we report shootings. And, the classic easy way to do it is just to take the police report and say, so-and-so got shot at thus and such a place, the police said. Well, that tells you exactly nothing. And, as a former reporter, I can tell you that it's hard to get the full story. I mean, sometimes people want to talk about it. Sometimes they don't want to talk about it. And it's tough work to do. But I think you all hear stories every day and you know that people do want to tell their stories if they think that they're going to be listened to appropriately and sensitively.
Yeah, and I think also one thing that we're learning from our patients about how the media tells stories is that's a little bit at odds with what's news, is that people don't want to talk right after they've been injured, right? The story for a survivor of gun violence, which is, by the way, 80% of people who are shot in the city, is about a lot of times about resilience and recovery, and they can be such incredibly inspirational stories. And those aren't those kind of episodic reports. And we actually know that when you keep consuming those episodic reports, like the 26-year-old man shot on Broad and Tioga, audiences or public will blame victims when they hear those stories. And it's so important to contextualize, like we've been talking about gun violence in terms of its root causes, and really distinguish, we're talking about victims and not perpetrators, right? And centering their voices and their perspectives. So.
Absolutely. I'm starting to get some good questions here from our audience. We have a gentleman here saying, are you advocating for mental health professionals to be part of the 911 system? Do you think that is part of a public health response, or is that more of a damage control situation?
I think that there should definitely, and there's some, I know in Connecticut, in New Haven, they have, for example, a program where they pair, when the police responds to incidents of violence, they pair a trauma therapist with the police officer to go to the scene. And I know there's a lot of people advocating within the city of Philadelphia to have a stronger presence of mental health professionals, and to distinguish, like when there's a mental health crisis versus calling 911, involving someone who knows how to de-escalate certain situations. So I think that's a great question.
Do you find that people this is my question, do people accept the mental health assistance, or is there still a stigma around it that is a barrier sometimes?
I don't think that those things are mutually exclusive. I think that there is somewhat of a stigma among certain folks. And I think, I think that even among the people who are aware of the stigma, many get to a point where they are absolutely willing to take advantage of that. But I think it has a lot to do with how it's presented, when it's presented, by whom it's presented. I think those are all key factors in successfully getting people to take advantage of mental health services.
Yeah.
I agree with Scott, and I totally. And I will also say that, the importance of, as a provider, presenting it as an essential need. And, you will be surprised when talking to people impacted by ongoing violence. A lot of them have mental health. As I always like asking people, what are your top 3 needs right now? to see if we can help them with. And mental health is usually presented as something that they really want to work on. And if you're living with full-blown PTSD, you're just not going to be able to function. So a lot of times, of course, we focus on housing, healthcare, employment, education, and we definitely have to include mental health as an essential need that we all have.
Just to piggyback, I think that mental health is also needed, but it's also representation of who's coming. I think that usually if someone is coming with the police, more people may be hesitant because they think that you are working with the police. They don't want to speak with the police. But I believe that if people come, especially people that looks like them, that are from the same walk of life as them, if they're able to come and connect with those who are violently injured or just their family themselves, I think they will be more open to getting mental health care. But even when I meet people bedside, their first thing, as Arturo said, is that I want counseling, I want therapy. And that's something new for me. I never thought that people are saying I want therapy, but more people are vocalizing that therapy is something they needed before the victim compensation forms, before any type of disabilities, before any like disability paperwork they need to fill out. They want therapy. They want someone that they can talk to that can provide just an opening ear and a listening ear that they can vent to.
Well, that seems very promising. Scott, you've been doing this for quite some time now. I think you've been at Temple for what, 20 years?
Nah, not quite,
No?
but about 17 years.
Oh, well, close. Okay.
Right.
How have you seen attitudes change in that time?
With regard to mental health specifically?
Specifically, but also with regard to solutions and public health solutions.
So it's interesting. I think obviously I think there's much more interest and focus on mental health. I think that Arturo and his organization was really at the forefront in the city when it comes to healing hurt people. And I think that when Dr. Goldberg and I started collaborating those years ago, she was the one that was really big on talking about gun violence as a mental health issue. And much of the work that we were doing was seen as heretical. And there weren't a lot of the old guard that really saw gun violence as belonging in a public health space. And now I look at folks like Jessica and her colleagues and this generation of young physicians that are coming in. And they're smart, they're aware of what's going on, they're advocates, they're agitators. The fact that they see Jessica is absolutely an agitator, but one of the things that you recognize is that they see their role not just inside the walls of the hospital, but tackling these issues from a more systemic issue, systemic approach. And that's huge. And I think one of the things that we're proudest about at Temple is that we try to give them that space. There's some growing pains. We're trying to adjust to the fact that we have such young, ambitious, physicians, but we're excited by that fact. And I've never felt better about knowing that now I'm not just the guy that's hired to go out there and think about gun violence. I defer to these guys all the time. So I think, that's a long way of answering the question, how has it changed? But I think that this is the attitude, is that more and more I'm approached by just about everybody at the hospital who asks questions like, what can we be doing? And that's everybody from people in transport to dietary to physicians. And so I think that that's one of the biggest ways that this has changed in the years that I've been at the hospital.
So that's interesting that people are asking what they can be doing, because that's really one of my questions. I think that people around our area that maybe have the luxury of living in a place where you can walk to school without worrying about being shot, might very well be wondering, well, what can I do to help? What do you tell people who want to help and don't know what to do?
Is that direct?
Anyone? Yeah, that can be you, Scott.
I feel like I'm monopolizing, and I want to hear from Rodney.
Yeah, I was going to speak.
Rodney?
For me, I would say that get acquainted to your local organization or organization that's doing the work. Provide your services, I would say, as a trained physician or as a whatever your position is in the hospital, wherever that may be, just be able to work with like different organizations such as maybe Healing Hurt People or other organizations that you can support. And I'm not saying like financially, but support goes a long way as far as just getting the word out of like what this organization does and how they support people who are victims or survivors of gunshot victims, or educating your friends and family. I would say that is also something important, just because you can walk out your home and you're able to, walk out home and being safe, but not everyone can do that. So just educating people on what are the disparities that people are facing that are in these neighborhoods that are severely high for gunshots or shooting victims.
It's a great point. What do you think, Arturo? What could people do to help with your efforts?
Yes, I echo what Scott and Rodney were saying, and I want to also emphasize that there's a lot of really terrific programs, grassroots organizations, and other universities and social services programs providing services to violently injured individuals. So I think the importance of also acknowledging the need to partner together, like to work together. And I will tell people, I think Rodney summarized it perfectly. Like, go to your nearest local community-based organization, and if you can, donate your time, volunteer, right, or spread the word. And something that Jessica said earlier, I think we need to change the narrative a little and talk about all the resiliency, the strength, the vibrancy of our communities. I've worked with so many grandmothers, aunts, mothers, like raising kids by themselves after the kids have lost their mothers and fathers to gun violence, and stories of these very resilient, strong women in Philadelphia raising their grandkids or their nephews and while working and keeping their community safe. So I think also I think that needs more visibility, right? And ideas that come from the community on how to solve or broach the gun violence epidemic.
And and also I would say, as Jessica said, as a systematic thing, it's like also policy. So as Arturo said, your local grassroots organizations, or find out, go to your local churches. I think the root of gun violence is disparities that people are facing, whether that's food, housing, any type of insecurities. So being able to help local organizations provide more housing security or more food insecurities, to support these local organizations that can tackle and dismantle the insecurities that people are facing in their own neighborhoods.
That's a great point. So every time you're working through a food bank or an educational foundation or Job Corps or anything like that, you're part of the solution. That's
I believe
a great
so.
point, Rodney. Yeah. So Jessica, I wanted to ask you, it's been a few years now since a certain organization advised doctors to stay in their lane, and it sounds like that didn't work.
Yeah, absolutely. I mean, I think I was kind of sitting here thinking when Scott was talking about sort of our next generation of trauma surgeons, just how exciting this time is actually, because, for a long time, you can see in the back of my office there's a textbook called Trauma. You see, for a long time, we were just responding to the bullet holes, fixing the damage that the bullet holes caused physically, and not really thinking about how to prevent them, not really gaining the expertise and sort of a public health approach to violence. But I think, and you can't tell a trauma surgeon that gun violence isn't their lane. It's literally my lane every single day. And the thing about physicians is that we're actually required to be advocates for our patients. And so as a trauma surgeon, I have to be an advocate for my patient, and that means working towards gun violence prevention. And I think that more and more we're recognizing that health and socioeconomic factors and social and structural determinants are so intersected, and it's so important for our populations to be healthy, to address those social and structural determinants. And that's my lane for sure.
And I just want to say, I thought at the time that it was hilarious. I've gone back and forth with gun rights folks, and I'm a gun owner, and but I thought it was hilarious that they, of all people to take on, they decided to take on surgeons who are basically folks who wear pajamas and Crocs every day, and then go headlong into the worst circumstances, as though you were going to somehow intimidate those folks. But I think what it did was it absolutely mobilized folks. It got folks talking. I think Jessica would agree that it presented an opportunity for a lot of different institutions to reach out to one another. I think that was a real spark, not just locally or regionally, but nationally. And this is quite a moment we find ourselves in.
Absolutely.
I just in terms of what can you do, there are, for decades, we've had no scholarship on this. We don't know which policies on a state by state level are associated with more or less gun violence. And I'm talking about related specifically to legal gun ownership. But now we know there's more every week. There's a paper coming out and more research on this. And that's actually where that came from. Stay in your lane. Don't do research on this. And so I think we know more and more what policies we should be advocating for. We do a lot of advocacy in Harrisburg. Some of that is, again, some political problems in terms of representation. And so, voting is very important, and educating yourself on what policies are associated with lower rates of gun violence is very important as well.
And we're not, just to be clear here, we're not talking about banning guns. We know that's not going to happen, not in this country. But there is a lot that can be done short of that, certainly. So I'd just like to conclude by acknowledging that all of you are in incredibly stressful roles. You are standing with people in their suffering every day. As you look out and see what is happening with this epidemic that we're experiencing in Philadelphia right now, what keeps you going every day? What enables you to keep showing up to work and fighting the good fight?
For me, I would say the people I work with, the young men and their parents that text me like, Rodney, he's changed so much. What are you doing? I'm like, I'm just being me, supporting the son. So I think that's something that definitely motivates me is those who I work with at our bedside, and they're doing well. They're reaching out to me saying, I have a job now. Thanks for supporting me. So I think for me, that's something important. Just being able to support people that looks like me, from walk of life like me, and that keep me going.
Well, that's wonderful that you get that kind of feedback.
Yeah.
Jessica, were you going to say something?
What keeps me going, I think, is our patients. There's never a moment where I feel like what I'm doing is not important, right? It's having the privilege of taking care of my patients, and how grateful and wonderful they are, and getting to see them recover and walk out of the hospital sometimes when they come in here so sick is so meaningful. But it is really hard to watch people suffer from something that is preventable. So I think the other thing that keeps me going is being a patient advocate. Those things have to go hand in hand. Yeah,
it's a great point. What about you, Scott?
I'm completely stubborn. So, I insist on, I'm not going to be defeated by this struggle. And I think I'm bearing witness to what we're building here, and in this moment that we're in which we find ourselves. I think that's what brings me back is feeling fortified and feeling encouraged by all the people that have joined this fight.
Wonderful. Arturo, can you wrap it up for us?
Sure. What keeps me going and doing this work is definitely the people I work with and our clients. I think the fact that we work with kids and young adults who've been through so much violence and trauma in their lives, and they still believe that things can get better. They come to us asking for help, and they show up every week. And you see so many of them getting better, healing from trauma. So that hope that they bring, I think we owe it to them to keep on the good fight and keep on working to make, the city a much safer, fair, and just place for everybody.
Wonderful. Well, I just cannot thank all of you enough. You have somehow managed to end a very somber discussion on, something of a note of optimism. And for that, I'm grateful. I hope that we can get together in another year and you all will have more hope, even more hopeful stories to report. And I hope that the Inquirer can continue to be a strong partner to all of your efforts in telling the stories that are constructive and need to be told.
Thank you.
Thank you, Charlotte.
Thank you. Thanks, Charlotte.
Thanks, Charlotte.
Thank you so much.